and welcome back to my channel. Yes, no makeup yet, just because we are going to be doing a get ready with me today. It's the second day of December. I actually was thinking of doing vlogmas, but then again, I can't guarantee that I am able to film daily. So we will see. Probably I will just upload as it goes. We'll just take it one day at a time. Anyway, so this is my new favorite foundation brush. This is from Real Techniques. It's a paddle brush, and you see it applies nicely. So I'm not sure if this is a new release from Real Techniques, but I got this from Ulta and I love it so far. I like that the bristles are so dense and it applies and blends foundation like a dream, as you can see. Right now I'm just using this Tarte, as always, Amazonian Clay BB Tinted Moisturizer. It has SPF 20. I already have moisturizer on and also lip balm. By the way, 2 weeks ago I had a terrible case of chapped lips, excess skin, and then I don't know, I couldn't control my hands sometimes, so I picked and then it got infected in a way. So I was dealing with four bumps there. Anyway, so I remember I used to tell my patients, is it okay already? Yeah. So I'm just gonna make it light today. But anyway, I remember telling my patients in the event that they experience cold sores, you know, because I work with lasers, yeah, and injectable. So in the event that they do experience cold sore, then they take or they apply arnica. So I said, you know what, I keep telling that to my patients, why don't I try? So I went to Down to Earth and purchased this. It's an ointment, and lo and behold, so I put it the night before. The following day I woke up, my sore is gone. Amazing, right? The packaging says it's for muscle pain and stiffness, swelling from injuries and bruising. We will see. Next time I have a breakout on my face, and we will see if it also works. I did have my radio frequency microneedling. I do have a video of that, but anyway, 2 days ago. And as you can see, I actually am surprised that my face is taking the beat better now than I was first doing it. I already explained what a radio frequency microneedling is, but that's actually one of the reasons how I controlled, or how I have managed reduce the size of my acne scars. Anyways, so what am I gonna use for my brow? Okay, so for my brows I'm just using this angled brush from Eco Tools and Kat Von D. Anyways, one update. I know that I've also mentioned in one of my previous videos that I attempted to quit coffee. Well, guess what, guys? I'm on my second, almost third week without coffee. And I know, why did I even quit, right? So I'll tell you a backstory. I've been drinking coffee since I was 19 years old. So it's been like, we're talking 2 decades, over 2 decades already of me just drinking coffee. But anyway, long story short, I just decided to quit because I don't want to rely on something to keep me focused, or I just don't want the dependence on something in order to thrive. That's basically what I'm trying to say. So I gotta tell you, if you plan on quitting coffee, do it on a weekend, or start on a Friday, just in case the symptoms extend, just like what happened to me. I'm telling you, the withdrawal symptoms, and they're real, you know. I experienced like severe headaches, and then extremely fatigued. I think I also told you, so many noises. I'm sorry about that. So in 2013, when I first quit coffee, just because I was having weird gastrointestinal symptoms then, so I was advised by my doctor to just quit coffee altogether. So the symptoms then were more severe than this time. However, it was shorter. I only like experienced fatigue and migraine for 2 days. But with this recent one, it is not as intense. However, I was debilitated for 4 days. I had to go home from work early just because I couldn't handle the headaches and also the nausea. And as soon as I went home, I really threw up. And I was like, my husband, see, I don't want you to go through that phase. Well, anyway, long story short, I survived the withdrawal phase. So can I say now that I am a recovering coffee addict? Funny. So that's one update. It's hard when focused. Anyway, next, I've been getting questions lately on how I became an aesthetic registered nurse. So to those of you who are not aware, vlogging is just a side gig for me. I am an aesthetic registered nurse specializing on laser procedures. Yeah, so how did I even got into that? Well, it is going to be a very long story because that will trace back to my early years as a new grad RN. So I've been in the industry for quite a while now, yeah? Some of you can pass for my children. Anyway, so I've been to different fields of nursing. And I think that helped me develop the skills and the management and what I call that, overall organizational skills. And for the most part, it's really the skills and the confidence in tackling new assignments, new tasks. How I wish I can tell you that I did this first, but my combination of education experience, actually, I would consider myself as somebody who always reinvents herself. Let's put it that way. So I've been to different fields of nursing, like I said, pharmaceutical also. I worked in a global dermatology company, also in the marketing management. So those experiences prepared me to what I have right now. I also thought about furthering my education, possibly nurse practitioner. However, I'm just kind of like you know, taking it one stride at a time. I do have a master's degree too. I adapt to every opportunity, and when I mean to adapting is that whatever it entails to get the job done right and efficient, then I do it. So when I was still in pharmaceutical, I think that having a master's would help me progress, or would help me further my career. Then that's exactly the reason why I took MBA, for me to hone my skills and my management style even more. But then again, sometimes, as the saying goes, when life throws you lemons, make thousands of lemonades out of that. Something happened along the way that I had to re-examine, reassess my life path. And for the most part, really, if you set your heart into that, and if you have a vision, you work towards that vision. So I know that's a lot of words to say just for you to explain how I got into aesthetic RN. Long story short, I helped the doctor set up his medical practice first, yeah, and then 2 years into that, just basically him and I, we started doing aesthetic. And then when I told the doctor that I'd like to focus on aesthetic and manage that, and because I won his trust, and that's how we started. That's how I started the aesthetic side of the business. So I'm aesthetic RN, but I am also the clinic manager, the business manager of our aesthetic med spa. Okay, so like I said, it goes beyond just treating a patient. What can I advise you then? Just because my experience is entirely different from what you may have at the moment. Finish BSN, be an RN, specialize in any nursing field. You are a registered nurse, you can be anything and you can do anything. Okay, so I hope that kind of help you boost your confidence. Number 2, ask around. Just like in any kind of job interviews or job applications, you're not gonna go anywhere if you're just sitting in front of a desktop. You ask around, you call around. Now, Will being certified increase your chances of being hired? Of course, especially if you don't have any experience yet. But take note too that you can be trained actually on site or in the clinic or whoever is your employer. So hands-on experience is favorable, but if you don't have, then yeah, certifications can help, but they can be pricey too. So that's the second, yeah, ask around and apply. That's long chit chat now, huh? I'm saying a lot of things. What's the next thing that I'm gonna do? You know what, I get sidetracked, so why don't I finish my finishing powder first? Okay, so that's about it. Remember this, and again, this also applies to everyone, yeah? You are only as good as your last performance. So keep on improving yourself. Never stop from learning. Don't get too comfortable. You know, learn from other people. Pick their brain. But patients will go to you for your skills and for your bedside manners and for your customer service. Those are the three things that I tell, you know, aspiring RNs if you want to go into aesthetic RN. I will liken the example to going to your favorite hairdresser. She may not have all the top of the line gadgets, equipment, but you go to your favorite hairdresser just because you relate to that. So same with me. I'm very personable, but I am very professional too with my patients, yeah? So if I feel that some patients are not going to be compliant with our treatment protocol, then I politely decline, and I just say that, you know, I mean, this works both ways. I am not a prophet, I am not a savior. We're going to do our best to minimize your skin issues, but it also requires discipline on your side, most especially sun protection, yeah? I don't even know if I'm going to wear eye makeup today. So this is Hourglass. This is their, I don't think this is the limited edition. Oh yeah, this is the limited edition. So I'm just gonna use the bronzer there for my eyes. Oh, the dogs are not happy. So that's that. I'm just using this too. Right after this, I'll be filming my holiday gift ideas, and hopefully you will also find amazing. I'm a contortionist, so hopefully you'll find great suggestions along the lines of vegan fashion and beauty. Okay, I'm gonna highlight myself. I don't know, let's see. Let's go to the lipstick. I don't know what I'm gonna wear today. Maybe just this from Ilia. I got this from the VIB Rouge sale a month ago. Was it? Yeah, a month ago. And you know what I forgot? Eyeliner, not eyeliner, but mascara. Mascara. Guys, this eyelash curler from Shuimura. 15 years already with me. But you know, I'm not throwing it, still doing good. This one is from Tarte. This is their waterproof mascara that I like. Next week I'm gonna have a hair color change. Not sure yet what will be the color this time, but this is our finished product. And let me just grab my perfume. And somebody texted me, let's see. So this is my finished look for today. How are we gonna name it? Laid back fab? Yeah, why not? So I will see you in my next video. If you haven't been subscribed yet, I hope you do. Thank you always for watching. Remember, be kind to every kind.